We are still in the midst of the global COVID-19 pandemic, and several countries appear to be passing through a second wave. In this video, I will share several key points and aspects pertaining to COVID-19 and how it can affect the eye. Please do watch until the very end, where I will share key points and tips about eye health during these strange COVID-19 times that we are all faced with and are having to deal with. My channel is about ophthalmology and eye-related content. It was therefore of great interest to me when I discovered that the late Chinese doctor, Dr. Wenny Lang, who was a practicing ophthalmologist in China, first reported concerns about a SARS-like outbreak in Wuhan. The alarm bells were raised by this ophthalmologist on December the 30th, 2019. Exactly 1 month after this alarm bell was raised, the World Health Organization, the WHO, declared this crisis as a public health emergency. And then on March the 11th, 2020, the issue was declared as a pandemic. The coronaviruses are a family of viruses that are believed to have originated from animals. The world has seen many crises before, including that of SARS and MERS. However, the latest global pandemic, which we are all currently actively involved in, which is believed to have originated from Wuhan, has changed the face of the world as we know it. This particular virus has affected everybody in some shape or form, whether it be students that have had their exams cancelled, whether it be adults of working age that have lost their jobs, or whether it be people who have been directly impacted by contracting coronavirus or their family and loved ones. The current COVID-19 disease is caused by the SARS-CoV-2 virus. In this video, what I will do is initially talk about the generic symptoms that can affect people with coronavirus. I will then focus my efforts on describing what the published literature comments on in terms of COVID-19 and its impact on the eyes. If you are new to my channel, please do consider subscribing, and I would be very appreciative of your time and support. In terms of the general symptoms of COVID-19, this area has been covered extensively, and this area is constantly changing and evolving as we learn which symptoms are typically affecting patients with the disease. The classic symptoms that patients tend to complain of when they are infected with COVID-19 include a generalized fever, a cough that is constant in nature and new, and shortness of breath. Initially, when the pandemic broke early in spring 2020, particularly here in the UK, the emphasis on the symptom of loss of taste and smell was not that marked. However, over time, this has now become a significant symptom that patients are asked to look out for. A proportion of patients are also asymptomatic, meaning they have no symptoms at all, yet they are infected with the virus. This is why the virus is such a nuisance, because it can be spread by people who are completely unaware that they are carrying it. On screen now you will see a list of common generic symptoms that patients can experience when they are infected with COVID-19. What I am going to do now is discuss some of the key findings pertaining to COVID-19 and the eyes. These findings have been mentioned in published literature. What the viewers need to bear in mind is the information that I am presenting today is accurate as of today. What this virus has taught the general public and the scientific community is that our knowledge is constantly evolving, and as we learn more and more about this virus and our knowledge base is expanding, we therefore are adapting our theories and understanding about how it affects the body and specific bodily systems. In medicine, when it comes to reviewing evidence, we have the highest, most sought after evidence that is classed as strong evidence, and that largely comes from randomized controlled trials, which take place typically over many months to years, take a lot of organization and monetary investment. These trials typically tend to have very large numbers of patients. It is usually randomized controlled trials that inform our knowledge base and update our knowledge base, and therefore they can dictate and alter clinical practice. Due to COVID-19 being a fairly new phenomena that has gripped the world, a lot of the findings that currently exist have been published in what is known as case reports. That simply means that the findings that I am about to discuss with yourselves have been observed in a small number of patients. What must be mentioned is that case reports, which is currently the only real form of evidence that we have available to us, particularly relating to COVID-19 and the eyes, is in fact one of the weakest forms of evidence. Each form of scientific literature has its own pros and cons. In terms of case reports, they are valuable to some extent. However, when grading the quality of evidence that they provide compared to randomized controlled trials, for example, they would be graded as a weak form of evidence. But what case reports are currently providing us with is an invaluable knowledge base that helps us to understand the disease and how it is impacting on the eyes. In time, as more and more data becomes available, this will undoubtedly improve knowledge and understanding and help to allow us to draw more firmer conclusions. You may be wondering and asking yourself how COVID-19 actually gets into the eyes. What I will now discuss is some of the key points that help to explain this. So the first method by which this can happen is by the creation of droplets. This can happen through mechanisms such as coughing, sneezing, talking or singing, and when these droplets then come into contact with one's body, such as if they touch the white part of our eyes, they can then penetrate into our eyes and then into our bodies. Another important point to try and understand is our nose and our eyes are intimately related. You may have wondered why when one is crying their nose tends to run. That is because our tear drainage channel is linked to our nose anatomically. This passageway has been proposed as being one of the other mechanisms and channels via which coronavirus can spread from one's nose or upper respiratory tract to their eyes. Another well-documented means of transmission is through touching infected surfaces, and hence the need and importance of thorough and regular hand washing and good hand hygiene practices. So if one touches an infected surface and then touches a mucous membrane surface such as one's nose, mouth or eyes, then this is a potential route for transmission into one's body. Some parties have also proposed and suggested that the tears which naturally sit in our eyes are harboring virus particles, and then these virus particles can be shed and go on to infect others. However, some parties argue that this risk is very low. In terms of COVID-19 and the eye problems that it can cause, what the published literature tells us is that only a very small number of patients infected with COVID-19 have eye symptoms. One paper found that out of 2,228 patients, only 95 of these patients, which is 4.3%, had eye symptoms during their coronavirus illness. What we do know is that when eye problems occur, they typically tend to involve a conjunctivitis or pink eye type picture, which means that one's eye may be watery, may show signs of discharge, it may be red, and it may be generally gritty and uncomfortable. Remember, conjunctivitis is when the white part of our eyes becomes infected and or inflamed. If you want to learn more about conjunctivitis or pink eye, I have made a video about this which you can see from my page. The difficult thing is that conjunctivitis can also be caused by a wide variety of other not only viruses but bacteria. Other features of eye involvement during COVID-19 illness may involve a sensitivity to lights and the sensation of something being in one's eyes. In an isolated number of case reports, some bleeding in the back of the eyes of some patients was also noted. Other published literature has suggested that eye signs may in fact be some of the first signs and or symptoms to be present prior to the development of the classic general COVID-19 symptoms such as cough, fever, shortness of breath, and loss of taste and smell, whereas other published literature has suggested that eye signs tend to occur when there is a severe COVID-19 infection. That brings me to the end of this video. In this video, I have provided an overview of what coronaviruses are, how they impact upon one's general health and symptoms they can cause, and then focusing mainly on how coronavirus can impact upon the eyes of individuals. It is important during this time to ensure that you follow local protocols and guidance provided by government organizations wherever you are in the world. These include doing basic things well, such as maintaining social distancing, practicing good hand hygiene, and wearing masks. As we are approaching the winter season, particularly here in the UK, it is also important to remember basic practices such as those of catch it, bin it, kill it, which essentially means if you cough or sneeze, catch it in a tissue and then bin it. Also remember, when your hands are not clean, it is important not to touch your mouth, your nose, or your eyes. During this COVID-19 pandemic, everybody everywhere has been impacted in some way, shape or form. Our reliance upon technology has increased substantially, whether that be homeschooling via Zoom, or whether that be meetings internationally via Zoom, or whether that be staying in touch with family and friends. It is important to remember that when we are using these different technological forms, whether that be laptops, computer screens or iPads, that we regularly take breaks and it may sound silly, but not forget to blink. These things, in conjunction with monitoring our screen time, will ensure that we try and prevent ourselves from getting computer vision eye strain and or dry eyes. During these uncertain times, all that anybody can do is to ensure that we do what is in our control as well as we can, such as good hygiene practices, good social distancing, and good adherence to local protocols. Ultimately, it is important that we look after not only ourselves, but our family, friends, and communities. Stay safe and thank you for watching.